There's nothing worse than losing your hair. Trust me, I know what it's like. Especially as we start to get older, we start to notice our hair thinning in the mirror when we get up in the morning. It's definitely, it's a heartbreaker, and I know. So this is something that we get in our practice almost every day. Guys come in, they're pretty young, their hair is starting to thin, and they're asking me, what can I do about this? So essentially what I do is I try to walk them through a process. I think patient education is very important. And it's important for the patients to know about their options, from the more natural, least aggressive, to all the way up to the surgical type options that we can have for almost any condition. In this particular case, hair loss. I'll tell the guys, you may want to start with step one, something natural, right? So here is actually a natural supplement. It's called saw palmetto. Saw palmetto is a great natural supplement. It's a good first place to start. You can find it at a lot of health food stores. This is a company I particularly like, but you don't have to use this one. And essentially what saw palmetto is called a DHT blocker. And what a DHT blocker is blocking what's called dihydrotestosterone. Dihydrotestosterone is theorized to go up to the hair follicles and basically starve them out to where your hair follicles aren't getting as much oxygen, blood, and nutrients. Therefore, they stop growing and you start to experience hair loss. This is a big step that guys are starting to use in trying to rebuild their hair. They can also buy other products where the saw palmetto and other herbs such as urtica, dioica, biotin, and nutrients are there. And what they do is provide basically more nutrients. The other herb in there, that urtica dioica, is very much like saw palmetto. Urtica dioica is also called stinging nettle. So whenever you buy or you're shopping around for those products, be sure you look on the back. You want to be sure they have those ingredients in there. They have to have those ingredients in there. Otherwise, you're just buying another fancy multivitamin. So be on the look for that. Another option that patients may want to consider that is not involved drugs is laser. The laser therapy, actually what it does is stimulate the hair follicles and the blood flow, providing more oxygen, blood, and nutrients to those hair follicles, and can actually stimulate regrowth of hair. And it actually does work. You may have heard of this company. So this company here actually, when you see their ads in the back of magazines and so forth, and what they have are these laser caps. And essentially what they have a bunch of these laser diodes in here, and they stimulate your hair follicles. They stimulate blood flow, oxygen, and nutrients in that area. It works good whenever you're just starting to thin and you're just starting to experience hair loss. It comes in a cap such as this. You have a little power pack. Basically what you do is you just turn on the power pack, the little laser diodes will come on. You put it on your head for about 20 minutes every other day. It's definitely an option. But it's going to require a little bit of work on your end. You're going to have to be consistent with it. It's about consistency with this. So if you're not going to be consistent with it, it's not going to work for you. It's not like you put it on once. It's something you're going to wear every other day for a year, 2 years, because as long as you want that growth, you're going to have to be constantly stimulating. If you're a guide routine, perfect. It's going to work wonderful for you. And if you don't want to be walking around with your hair cap, you have those other little things that they sell that actually help to kind of disguise it. So it's good. It works. That is actually mine. I've used it, and I have been very happy with it. But what I'm going to actually do is take another step further, which I'll get to in just a second. But before we get to that, we're going to talk a little bit about Propecia. Propecia are these little white drug pharmaceutical pills, and essentially what it is a very strong DHT blocker. It works the same way the saw palmetto and urtica dioica does, only much, much stronger. So it tends to be more effective. It does work at helping to regrow guys' hair. I've seen it work in many of our patients, but there's a side effect that some patients experience, and that's erectile dysfunction. No guy wants to have a lot of hair, but has erectile dysfunction. So oftentimes new patients will tend to shy away from that medication. If I have patients that have been on it for a while, they don't have any problems, we just keep them on it because they're not experiencing any problems and they're getting the hair growth. So it's working for them. It does come in a generic form, so you can actually get it for relatively inexpensive. It's something to consider. But you should always be aware of the potential side effects. Now, the next thing that I like is definitely something called PRP, platelet-rich plasma. Essentially what we do, we take the blood from your body and we're going to isolate specific cells to help regrow tissue, to help regrow hair underneath your scalp. So we take your blood, we isolate it, and we make something that's called PRP, platelet-rich plasma. And essentially, platelets are little soldiers in your body. They're repair soldiers. They're going to go in there and they're going to repair any kind of damage. So essentially what we do is we take those, we isolate them, and then we're going to reintroduce them underneath your scalp. And by doing so, we're telling those soldiers, you're going to start working right here in this area, and they will start to rebuild hair follicles, they'll start to rebuild tissue. They're going to basically help to revitalize that tissue, and it works really great. The good thing about it is it's your own body cells. It's 100% natural, there's no drugs, and you don't have to do anything after that. After you have the procedure done, there's nothing you have to do. You don't have to wear a cap, you don't have to take pills. So it's definitely an option. Now granted, you're going to want to do it 2 or 3 times because of your hair has certain growth cycles, but it's a really good option, and it's probably the coolest, newest things out there. After that, then you may want to get into surgical options. But I always try to push guys towards more of these other options first before we go there. Surgery can be very expensive. And again, none of this has its guarantees, but there are definitely options that are out there. So I encourage you to check out our blog. You can click on the description below, give you a little bit more information, or you can click on one of these videos where we talk a little bit more about the PRP procedure, and it might actually be a good option for you. So please check it out. If you have any questions, give our office a call, and we'll be happy to help you out. Thanks a lot.